Healing of Wounds and Burns by Colby Brown. So describe wound healing, and it's the specific events in the healing process depend on the nature and event of the injury. So cuts, they're breaks in the skin and must heal to prevent infection and blood loss, and burns, and they take weeks or a few days to heal with no scarring. And on the right, it shows the first degree burn, a second degree burn, and a third degree burn. So the stages of wound healing are your body heals a wound in four main stages. The stages include preventing too much blood loss, defending and cleaning the area, and repairing and healing. So the first stage is to stop the bleeding. When you get a cut, scratch, or other wound in your skin, it usually starts bleeding. The first stage of the wound healing is to stop the bleeding. Blood begins to clot seconds to minutes after you get a wound. Stage 2 is scabbing over, or clotting. Clotting in scabbing phase has three main steps. Blood vessels around the wound narrow. This helps stop the bleeding. Platelets, which of the clotting cells, which are the clotting cells in blood, clump together to make a plug in the wound. Clotting or coagulation includes a protein called fibrin. It's blood glue that makes a net to hold the platelet plug in place. Your wound now has a scab over it. Inflammation, which involves cleaning and healing. Stage 3, rebuilding. Once the wound is clean and stable, your body begins to rebuild the site. At this stage in healing, you might see a fresh raised red scar. The scar will slowly fade in color and look flatter. The last step is maturation and strengthening. Even after your wound looks closed and repaired, it's still healing. It might look pink and stretched or puckered. You may feel itching or tightness over the area. Your body continues to repair and strengthen the area. And if you go back a few slides, right here, it shows pictures of the stages of wound healing. So blood clot, and then the next one it shows the fibroblast, the microphage scab, and then the next one the fibroblast, the proliferating, and the subcutaneous fat, and then the last one is where it looks healed, but it has a scab, what it looks like, and it's freshly healed epidermis and freshly healed dermis. So yeah, and then also poor wound healing. The blood supply is the most important factors in wound healing. We need proper. Okay, so the citations. So here are my citations, and thank you so much for listening to my presentation. I hope you have an amazing morning, evening, or night.